Alright, hey guys, it's Lee. It's November 14th of 2011, and the last video that I made, I believe, was on Transhealth, and in it I said I was having to potentially go and get an ultrasound done of my uterus. My doctor wanted me to go and get one done to make sure that the lining hadn't been building up because of the testosterone, and that it was either reabsorbing or eliminating or doing whatever it had to do. So I went and I got that done, and it was actually a very interesting experience. So I went to it wasn't a radiologist, it was a little clinic, where that's all they do. So, I mean, theoretically I should have been in and out, but my doctor's office messed up and gave them the wrong insurance, so the place had to call and verify my insurance and all this jazz, so it took a little longer than I expected. But when I got there, walk in, filled out whatever forms I had to, gave my ID, and my insurance card, and I didn't have any problems while I was sitting there. I was called, Mr. and Sir and all this jazz, which I thought would have been a problem because the gender marker on my ID and on my insurance is, sorry, okay, is obviously still female. So when I got called back, that was actually when the interesting part of this whole visit began. The tech comes out and gets me and says, "Hi, are you Lee?" And I said, "Yes." And she's like, "Well, coming back, okay." And then the inevitable question, well, what are you here for today? Now, for some reason, I honestly thought that they would have sent paperwork. I mean, they knew I was there for an ultrasound. They knew that it was going to be abdominal. But why they didn't know exactly, where in my abdomen the ultrasound needed to be performed, I'm not exactly sure. So, and it was a female tech. I don't know if I said that, but it was a female tech, and she says to me, "So what are you here for today?" And I go, "Well, and not this calmly. I mean, understand there was a lot of pauses, but I go, "Well, I'm here for an ultrasound of my uterus." And she goes, "Your uterus?" And I said, "Yes, my uterus." "Well, and you could tell immediately." And she's like, "Well, why do you need an ultrasound of your uterus?" I said, "Well, I've been doing testosterone injections, and because I was trying to give only so much information, hoping she would piece it together. I couldn't, I don't know, I knew I was going to have to out myself. I knew this going into this whole process, but to be honest with you, I just didn't want to. I didn't want to say it. I didn't want to say it. I mean, part of me was just plain out embarrassed. There's no way to say it, and I just didn't know how to. This was the first situation where I've had to actually say this to somebody, because everybody, like I've said before, who I'm around, it's a safe zone, they get it. But obviously this tech didn't get it. So I go, "Well, I've been doing testosterone injections, and they've stopped my periods. And since they stopped my periods, I needed to, my doctor wants to make sure that the lining in my uterus hasn't been building up, and it isn't, becoming malignant or anything like that." So, you can see she's starting to become a little more clear. I think at this point she just thinks I'm a bodybuilder or something stupid. I mean, because, and no offense to bodybuilders, but just something other than, trans. And, she could see I could see it starting to piece together. But then I see her eyes go to my face with the facial hair that's coming in. And, she goes, "Well, why are you doing testosterone injections?" And at this point I couldn't stand it anymore, so I'm just like, you know what, I'm a female to male transsexual, and I'm taking the hormones to begin my medical transition. And she's like, "Oh, okay." And she still didn't get it. She's like, "Well, I just needed something to, write on my paperwork documentation so that when they So they look at your ultrasound, and they know what they're looking for. Excuse me. And I said, okay. So she goes along and, gets the gel out, and, I have to expose the area, and, it's all hairy and everything. Yeah, it was, and once we got past that little hump, there was still tension in the room, but it wasn't quite as bad. It just, I was just, it was just actually a very humorous situation. And what kind of made me feel a little bit better about the whole thing was that, I looked at her and she was way more nervous than I was. I mean, really, if, just in the whole grand scheme of things, she was way more nervous than I was. And I'm not sure if she was nervous because it was I don't want to offend you, or you just, I've never met anybody like you, and what you're doing to yourself is, that whole side of things. So, that was that. The other interesting thing that happened recently, which isn't exactly related to Transhealth, but it kind of was related to the whole, outing yourself. Not to me, but to somebody else. I was working the other night, and we got word from downstairs that we were going to be getting a patient. And as the nurse is getting a report, I hear her go, "What? Huh? Wait, I don't wait, does she have breasts? What?" And I'm like, well, that sounds interesting as far as the whole, gender thing is concerned. And so she gets off the phone and she looks at the team lead and goes, "Okay, we're getting in a female, but when this female went to get an X-ray done, she asked for a urinal. And if you've ever seen a hospital urinal, there is no way, I don't think, that a female can use them. Like, I don't think anybody, okay, let me reword. I don't think anybody with female plumbing could use it. Unless you are extremely skilled. So, the woman goes, and then, so the tech who's doing this x-ray for this woman goes, are you sure you need a urinal? And the woman's like, yes, I need a urinal. So, the tech goes and checks with this nurse, and brings this lady a urinal, and, goes and lets her do her business, and comes back and the urinal's full. I mean, full to the point where you couldn't even, rotate, you couldn't even rotate it, and use it. I mean, it was 100% full. So, the nurse is all up on my floor. We're trying to figure out what exactly was going on. And, I'm thinking, and here's me going, well, it's a trans woman, who just didn't have her, vaginoplasty yet. And I'm like, well, she's trans, pretty much simple as that, she's trans. And they go, and they're not listening to me, the nurses are doing their own thing. And the team lead goes, well, maybe it was a hermaphrodite. And I'm like, well, that's possible, That's what I'm thinking to myself. So, and then they just started, maybe it's a sex change, maybe it's this, maybe it's that. And when sex change came up, all the nurses started to giggle and to laugh and to not act, how I would expect, Most times in the medical field, you would assume that you're just taking the knowledge you're given and move on, and there's no judgment call because you pretty much have seen it all. That's like I hear a lot of the nurses say, what they say to the patients that come in, because the patients that come in, normally, and it's a county hospital they work at, so it's like, well, they come in with drugs in their system, many of them illegal, and the nurses go, I don't care what you took, I don't care if you took meth, heroin, you took excessive sleeping pills, I don't care what you took or what you have in your system. I just need to know so that whatever drugs I give you isn't going to interact with them and cause you to be sick. I mean, that's seriously it. They don't care. And I don't think you should care. But, because, like I said, you would assume that it's, there's no judgment. That they're there to, you know, that the people are there to get help, and the nurses are there to help them, and, you know, like I said, you'd figure the nurses would have seen everything at least once before, but they haven't. So, in the midst of all this, I'm like, well, and they know me. They know me as a male. You know, they've seen me and, you know, have interacted with me, and, you know, we've been working together for about a month now, so you figure we have some a little bit of personal connection, right? So, I mean, I can't stand it when people get to this ignorant thing, in this ignorant phase, and all I wanted to do was, you know, just shake them. Just shake them. And, or very simply, I was about to come out. I seriously was about to out myself, because I hate when people do that. I was telling my girlfriend this the other day, you know, I don't live stealth. I mean, I really don't. I mean, in the grand scheme of things. And the only reason I'm a little bit hesitant at work is because it's a really good paying job, and I really don't want to lose it. Or get called into question, or, you know, or have somebody that I work with be, you know, so paranoid that they start to, you know, look for things to nitpick at me about, and, you know, things like that. I just don't want that. So, so sad to say I didn't do it. I did not have the courage to do it. I did not have the courage to out myself in order to enlighten and educate. I didn't. And I'm actually very disappointed in myself for that. But, like I was saying, I don't really live stealth. Like, in the grand scheme of things, I really don't. And in some way, I guess the best way to explain it is, when I was working retail, I worked with somebody who was Jewish, and, you know, one day somebody decided to get on this spree of Jewish jokes, and some of them were kind of funny, but some of them were just plain out wrong, and the person, you know, took it for a little bit, you know, while they were lighthearted and humorous, and then later, you know, kind of got to the point where they're like, you know, I'm Jewish, and that kind of implied, like, this whole, you know, shut up, you don't know what the fuck you're talking about, you know, you're just being disrespectful. It's like all that came out when this person said, you know, I'm Jewish. And that's kind of what I wanted to do at work. I tell my girlfriend that being trans in a way is having an ace in the hole for civil rights and gender rights, because when you get to the point where you're passing and being validated as a male or a female, and then you say, you know, and then you hear all this bigotry around you, and, you know, you come out and simply say, well, I'm trans. You know, it kind of has the same implication, you know, I'm trans, you're being disrespectful, I would really appreciate it if you stop. It's like all that is summed up in such a simple, in 2 little words, 3 if you don't use the combination, but of I and am, but I was actually really disappointed in myself, you know, because I know nothing. I know that, like, when gay civil rights were starting, and people, you know, and the big thing was, you know what, come out. Just simply come out, stand up, you know. Own yourself and own what you are and who you are. Because only in that way will, you know, education be brought, and knowledge forwarded, and, you know, we'll be seen as what we are and not as this. We'll start to clear up misconceptions, and we'll start to get, you know, the recognition that we sort of deserve. And in some ways, I feel that's what the trans community needs to do in a certain light. But I'm very disappointed to say that this time around I couldn't do it. I couldn't out myself. And I am hoping, honestly, that I have the strength next time, because working in the healthcare field, I'm sure this is not going to be the last time that I encounter this issue. So, or this personal challenge to myself. So I think that's it. I hope everyone's doing good, and I'll talk to y'all soon.